second thing is, even today, we're hearing from you. We're recognizing and trying to address the needs. And I'm hearing a lot of people talking about wanting to get at the data and get access to it. And we've always talked about doing that in an efficient way. As we said, if we printed all this up, it'd be 500 plus pages times 70 people that are here. It would take us 6 hours just to transport it here. But I can see today where this data is on the internet, in a downloadable form, in a searchable form maybe, where people can get access to down to the very little name of the organization, the business. We have to talk about people. People may not want to be identified, maybe they do. But that day is coming. But we can't do it all at once. We need your input to know where to start, where to get going. But it's coming, and we're going to do it. And we're not even going to stop there. We're going to work together to decide what to do with it, to where to make the change, and where to improve things. This doesn't stop with data collection, but it's going to be work together. All right. Here's what we're going to do during lunch. We want these conversations to continue. We think they're important. Life isn't always easy. I'm not looking for it to be easy, but I think we need to hear these things. So at your tables, we want you to talk about the things that we've talked about. And there are four real questions that we want to hear from you. One, what are the priority areas? What are the most important? Leon talked about the Men and Family Center and the Charm City Clinic, and knowing about if knowing about those kinds of organizations that are assets are important for your table or you, then list those for us. And we want, and from each table, at least the top three. But if you got more than three, put down as many as you like. All right. You can use the handouts that we gave you that talk about the overarching themes to guide you, or you don't have to use it if you don't want to. If you don't want to use that, or you already have a good idea, we just want to know what you think are the priorities, because these are going to be the areas that we're going to drill down, we're going to get the data, and then we're going to use to do something with. We can't cover all the areas all at once. So where do we start? We're asking you, where do you think we should start? So tell us at least 3 priority areas based on the discussion at your table of where you think we should start. And we'll leave this slide up, and so you don't have to remember what I'm saying. You can always refer to it. Yeah.
Health is a main priority. There should be no one without any type of health care. And these systems that we deal with, that people will, I know what I'm saying, and y'all already listening. People who are of low income, who have resources like social service and whatnot.
Can you speak up so we don't hear you?
Someone who may be an addict will get help before a single mother. And things like that are not right. And me, from my standpoint, jobs is a major thing to do. Because a lot of the underlying problems in the neighborhood, as we were discussing over here, true enough, drugs. It's going to always be a problem because there's supply and demand. But if a lot more people had jobs, a lot more of these young guys had jobs, they wouldn't be out there selling in the first place. And then you can actually catch the people with the big meth labs or the big shipments of coke and all that, instead of catching some little guy who got 3 pills on him and sending him to jail for 3 years, ruining his life. So people need jobs and people need health care. Point blank period.
Absolutely. This is exactly the kind of conversation we want you to. I suspect every one of you has 2 or 3 or 5 or 7 priority areas like that. So talk amongst yourselves and decide as a table, as a group, where are the ones that are the highest priorities. We put note cards on each table. Each table has some note cards. You guys see the note cards? Everybody see the note cards? Use the note cards to write these things down. Number 1, the priority areas, and try to limit it to your top 3 or 5 if you can. Number 2, tell us, a little bit about why this is important to us, to you, and what do you think we can do with this information once we have it? Because like many of you have said, we got to move to action. And so we got to start thinking about what are the actions you want to take with this data. That's the whole purpose of getting it. So tell us what you think. If you want to know about these neighborhood associations, tell us why. Why do you want to know about it, and what can we do about it once we know what they are? So that we can even now begin getting ready for that next stage where we can then start doing what it is that we want to do. Okay? And one more thing, and then I'll take a couple of comments. And then the last thing is, if there's any of you at your table who want to be a part of this process, who want to look at this data and say, help us pull it out, because it's a lot. And we can't sit here. They took 4 people almost 6 months. 4, and actually they're not done because they're still doing the Hispanic ones. 4 people, almost 6 months, just to listen to every single one of these and to pull out what they thought were assets and then categorize them in codes. 6 months, 4 people. We need your help. It's one thing to complain. It's another thing to think about assets. It's another thing to help. If there's anybody at your table who wants to help, to be part of the process of getting this to where we can then use it and work with us and has the time, and we know everybody can't because people work and everybody has responsibilities, but if you can, we want to work with you. Put your name, put the names down on those cards and contact information. Whatever it is, phone, email, whatever, your address, if you want us to come knock on your door, whatever. We will reach out to you. We will work together to find the best times where we can meet together over the coming weeks to delve into this and to get this to the way where it's most useful to you and to us, and then we can do something about it.
Is this a paid position?
These are not paid positions. These are totally voluntary positions. And we recognize everybody can't do that. Some people just aren't able. Understand. So if you are able, let us know. Okay, Leon.
Now, earlier I made a critique about the process. And what I want to share with you all before people start leaving was that the process was like it was because enough community people didn't show up. So if you're going to start complaining and so forth at the back end, and you should have at least been a part of the process. And because you weren't, it was directed primarily by Hopkins people that were at the table because they were the ones attending the meetings. So a lot of times the community get things done in a way that they don't like it, but when you have an opportunity to be a part of it and craft it the way it should be crafted, you got to show up and be accountable. Now, I have talked to Bob about compensating some people because everybody can't afford to come to all these meetings. There was a lot of meetings for years.
It sure was. Sure was.
But at the same token, we have to look at how things happen in this community and why they happen. And when you have an opportunity to change it or at least mold it the way you need it to be molded, you got to take advantage of it. If you can't come every meeting, you got to try to make at least half of them. And that's been a complaint I've had from day one. I called Nia and asked her to get some people to the meeting because of this asset mapping thing. But the only time people showed up was when it was $50 hit up. And I don't blame you for that, but you know, if we want to make changes in the community, we got to do it when it's not $50. Because this is important to us. If we want to know the assets, you all know more assets than the asset mappers came up with. But you weren't here to help, so don't criticize. And when I say something, because I attended most of them meetings.
Leon was here from the
And raised hell
He
from
was.
day one.
He sure did.
You know, so I'm telling you what I know, and you know, if I wasn't there, I would shut up. But I was there. And I'm telling you all, if you want to change things, we gotta stand up and move the ship along together, not one person. And then you got all of these people from Hopkins that showed up at all those meetings. You can't blame them. They were doing their part. You got to do yours. So when I complain, I'm going to complain, but I'm going to give credit where it's due, and I'm going to let you know where we fell short at. and we did not show up as a community. So if we want to change the community, bring your bus to the meeting.
Excuse me.
All right,
Excuse
let's-
me. I mean, he's praising those people from Hopkins. Were they paid?
We, over the course of this whole project, we talked about the realities of life. And as Leon pointed out, people can't do everything for free. And we went back and looked at the resources that we have to see where we could do to put to that. We admit to you that we could not pay everybody for every single meeting. We admit that.
Let me answer your question directly. No. There was no one from Hopkins whose job is to be here at 7 o'clock at night. No one. There was no one whose job was based on doing this survey. No one. We did it as so many of our community partners did because it matters to us to be in the community where we live, because I live in this community and work. So that's straight up the answer to your question.
And on top of that, we did find some research. We know it doesn't cover everything. This is not the first community meeting where we offered a stipend. We know it doesn't cover your time, but $50. This is not the first one. We've done it before. We also, with the data collectors and the program manager and the others, we paid them. We did pay them. So there have been monies coming to, we know it's not enough. We don't pretend on that. But that's how we answer. We're trying always to look for more resources to do more. But Leon is right. We all got a part to play. Yes.
Technically, the question that was asked is that most of the Hopkins people are paid. If they're salaried employees, they're paid. If they get workers' comp, they're paid. But the bottom line is, you can't pay everybody, and I've been talking to Bob to see if we can maybe get some financial assistance so we can give some people some compensation, because
Right.
that's a lot of time that's spent in these meetings.
Right.
But that was a good question, and that's
right.
something that Bob will tell you, I've been arguing that point
Absolutely.
for a while, so it's not new.
Right. That's what I said. Well, I just wanted to give you the background. That's not new. For those of you who are your first time, you might think it's new, but we've talked about it. We don't have a perfect solution. We've done something to it. Let's get to the work. I really want you guys to get into, keep these conversations going at your table. Nominate somebody or we have somebody at each table to help lead the or they just pick one. So nominate somebody at your table to take the notes or write down the things and engage in the conversations. 3 priority areas, what we can do with those things, and if anybody is able and interested to work with us over the coming weeks to take this forward.